Good morning and welcome to the International Press Center in Copenhagen. We are glad to have some of you journalists here in the audience, and also for the ones who are watching this press briefing online, we are of course happy to welcome you. I think we are in a position, we are very happy today to be introducing a very interesting speaker from the University of Aarhus, who's conducting with his team a lot of research around the whole COVID-19 crisis and how to manage communication, people's behavior, all sorts of trends surrounding this global crisis. So welcome again to the International Press Center. I'm very happy to introduce Michael Bang Petersen from Aarhus University, who will start by doing a presentation this morning. Michael, welcome.
Thank you very much. So, what I'll be talking about today is the pandemic as a crisis and what we have learned about that from the research that we are doing, how people behave doing it. And if we look at the recipe for success during a pandemic, then first of all, it's about behavioral change. People need to change their behavior, they need to keep a distance, they need to wash their hands in order to fight off the pandemic. And in this way, we cannot, during a pandemic, do as the British suggested that, as the Brits suggested that their citizens did during the Second World War. We cannot keep calm and carry on. We must drastically change the way we behave. Furthermore, the other key ingredient for success is speed. So the behavioral changes need to happen extremely fast. So this has been sometimes described as the hammer and dance theory, that you need rapidly to hammer down the infections and then dance with it afterwards. There's emerging evidence suggesting that whether or not lockdowns were delayed with days or weeks did matter hugely in terms of the number of deaths. Finally, the third important ingredient is leadership. So people need to change their behavior rapidly, but the way it is facilitated in democracies is through the leadership, through the communication of politicians and health authorities. So this means that fighting a pandemic requires insights far beyond Fighting a pandemic requires insights far beyond the expertise of ordinary medical doctors. It basically requires the use of behavioral and social science insights. What I'll be doing today is to talk about behavior during 3 phases of the pandemic as it has unfolded. So first of all, I'll talk about how has citizen behavior changed during the initial phases of the pandemic when infections started to spike initially. So what happened is that the infection spiked and citizens changed their behavior, and then afterwards a very long sort of period came with falling infections. And the question there is, how do we sustain behavior in this prolonged period where things are going down, but we still need to keep our attention to distancing and hygiene? Finally, we are in another situation now. We are in a situation where, again, here in Denmark, but also in the rest of Europe and other places in the world, that behavior is, or infections are rising once again. So how do citizens react in this situation? How do we adapt our behavior? So these 3 phases is what I'll be talking about today. And I'll do so on the basis of a research project that I'm leading, the so-called HOPE project. So HOPE is an acronym for the project name, which is How Democracies Cope with COVID-19, a data-driven approach. This is a major cross-disciplinary and a cross-institutional project. It contains a collaborator from Aarhus University, Copenhagen University, and the Technical University of Denmark. It is funded by 27 million Danish crowns by the Carlsberg Foundation, and we combine huge amounts of data using ethnographic methods, the scraping of social media data, mobility data from cell phones, GPS signals, and so on, and then survey data. We are collecting these data both in Denmark and across other Western countries. What I'll do today is that I'll focus on the survey data and mostly, but not exclusively, on the findings from Denmark. In the project, we do classical research, answer research questions in a data-driven way, but we also, in the project, provide reports, data, and advice to the Danish government. Everything that we feed to the authorities, you can also find on the project website, hope-project.dk. Okay, phase one, changing behavior. What have we learned? In the initial phases of the pandemic, policymakers and authorities, both here and elsewhere, were afraid. They were afraid that the public would engage in panic. This has again come to the forefront of the agenda across the world after the new reports that in the United States the COVID pandemic was explicitly played down in order to avoid panic. So the question is, how much should leaders say, and when should they say it? This was something that I was quite vocal about in the Danish news media in the very, very early phases of the pandemic. And accordingly, I was invited. Oh, I don't know what is happening, but I will go back. So I was invited to a meeting with the Ministry of Health on March 11, exactly a year ago, on the day that we engaged in the lockdown, or when the lockdown was announced, where we were discussing some of these questions. How do we avoid panic? What I said was that there is no other way than to tell the truth about the coronavirus, to trust the citizens, and use behavioral science. And one of the key insights from behavioral science in the context of major crises like the one that we are in today is that we shouldn't fear panic. Publics don't panic. Rather, some level of concern or anxiety is in fact productive. So what I was arguing is that we need what you can call optimistic anxiety. You need publics to be anxious enough to listen to what they should be doing, but you also need them to be optimistic enough or feeling capable enough that they are in fact acting. And it seems that this kind of sentiment of optimistic anxiety was in fact established in the very early phases here in Denmark. So what you can see here is the development in feelings of anxiety and feelings of optimism as assessed by surveys in Denmark from the day of the lockdown, March 13, and then the last data point here is from the end of May. So the red line is the proportion that reports anxiety, and the blue is the proportion of Danes that reports optimism. And as you can see, around 80% both reported to be anxious and optimistic that we could in fact handle the corona crisis in the initial phases of the pandemic. And then as infections went down in early April, anxiety began to wear off, whereas optimism remained high. And consistent with this argument that this kind of sentiment is conducive for engaging in behavior, we also see that Danes engage in dramatic behavioral changes. So this plot shows you the proportion of the public that experienced high degrees of changed behavior in order to avoid infecting others. And again, we start on the day of the lockdown, March 13, where around 50% reported that they, to a high degree, had changed their behavior in order to avoid spreading infections. After communications was ramped up over the next few days, this rose to around 75%, and then when infections went down, behavioral changes slowly went down again. As you know, this intervention was successful, and we saw a rapid decrease in the number of hospitalized cases here in Denmark. So the question is, who did change their behavior during these initial phases of the lockdown? First of all, we looked at the role of fear, and we saw that people who were more afraid of the coronavirus, they did indeed change their behavior more. We have also assessed the role of sympathies for the Prime Minister, whether you trust the government. And one of the important insights is that this actually didn't matter much. So independently of whether the Danes had positive or negative feelings towards the Danish government, they changed their behavior. What was the most crucial factor was essentially their knowledge. If they felt that they knew what to do, they basically did it. Let's see. It seemed, at least something happened. So this was the most important factor. And what is interesting is that if you felt that you had the required knowledge about what you needed to do, then fear didn't matter. So you actually complied without fear if you felt that you had the needed knowledge. So in that sense, one of the key things that were driving behavior change in Denmark was a public sentiment that said, well, tell us what to do and we'll do it independently of whether we, under normal circumstances, would be skeptical about this government. What then about the second phase, sustaining behavior? We saw that behavior was slowly going down when infections were also going down. What we saw especially over the summer was a rising number of contacts. So the blue line here shows from mid-April until beginning of August the number of what you can say infection-relevant contacts that each Dane has over a span of 24 hours. And we can see that there is a sharp increase from around mid-May until July, and then there's a relatively stable level of contacts. So this could suggest that, well, maybe people didn't care anymore about the virus over the summer. But in fact, one of the key things that we have found is that people were actually quite attentive over the summer, even though that their behavior changed and the contact changed. So what these graphs show is the daily measured attention to keep hygiene and attention to keep distance. And as you can see, so this is from mid-May until beginning of August, and as you can see, the attention to keep a good hygiene is completely stable across the summer period. And the attention to distance does drop a little bit from May until June, but over the summer where we're seeing this rise in infections, rise in contacts, then it's relatively stable. So what this suggests is that people's behavior can change even when they're actually motivated to keep it up. So I think that points to at least one important factor about how to sustain behavior, and that is the need for structure. So during the summer period here in Denmark, there was a number of initiatives, such as you get a free ferry ticket, you get a discount on access to theme parks and so on. And basically, the distance in any room is a function of two things. It's a function of the motivation of the people in the room to keep a distance, but it's also a function of the number of people in the room. And what effectively happens when you are reopening is that you are perhaps I should get the keyboard. What you're doing when you're reopening society is that you effectively are pushing more people into the public room, so to speak. And it's just more difficult, even if you actually want to keep your distance. What this means is that when you are operating in a reopened society, you really need to think carefully about not just citizens and not just authorities, but really the whole level between citizens and authorities, which is shops, institutions, and employers, how they can create the needed structure such you can move around, but still keep a high degree of focus on health advice by, for example, putting hand sanitizer in very easily accessible places, thinking about how you can easily get off work if you have symptoms, how shops can create very clear signals that you need to keep a distance and so on. So it's not just up to the citizens, it's also up to everyone who structures our everyday lives. But there's also another thing, and that is that we need to develop new practices. Because how do you in fact behave in a protective way in a reopened society? It's very, very easy to keep a distance when the whole of society is locked down, when there's no bars to go to, when there are no parties to attend to. But how do you do it in a reopened society? One of the things that we are finding is that while people have been sort of highly attentive to following the health advice, at the same time, their understanding of what the health advice entails has changed over the period. So what this shows is the proportion of Danes who experience the health advice as restrictive, that is, that it constrains their everyday life. And around 50% thought so in the middle of May that it was restrictive, but only 30% thought it was restrictive by the beginning of September. So the point is that people are equally motivated to follow the health advice over the entire period, but what they hear when they are being asked to keep distance is very different in April than it is today. So this is one of the other things that means that behavior can change even when motivation is constant. And there's a need for informing people about what they concretely need to do in order to act in a protective way in this radically new situation that we are in today compared to April. And in this regard, I think one of the most important insights is that you get basically exactly what you ask for as an authority. One of the, during May, when there was, when the sort of reopening of Denmark was beginning to increase, then the director of the National Health Agency here in Denmark, Søren Brostrøm, was out saying that, well, in a reopened society, hygiene is more important than distance. And the Danes listened. What you can see here is that this is the proportion of Danes who washed their hands more than 10 times yesterday. This is for August. And what we do here is that we compare Denmark to 7 other countries: Hungary, France, the UK, Sweden, Italy, United States, and Germany. And Danes are the sort of winners in terms of hygiene. We hand sanitize, we wash our hands as much as we can. So over 60% said that they yesterday washed their hands more than 10 times. But if you look at the proportion that are avoiding rooms with more than 10 people, then we are the losers. Then the proportion of Danes who do that is smaller than in any of the other countries that we have surveyed, although it's more or less equal to Italy and Sweden. But the point is that people are motivated to do exactly what the authorities say. So if they say prioritize hand washing and hand hygiene, then that is what people do. So it's very important to be concrete, tell exactly what you expect of them, and then it looks as if they will actually do so. What then when situations change? What is happening currently is that we are seeing a rising number of cases. So September 7th, it was 230 daily cases. Yesterday, it was 317. Let's see what it is today. And the way this is currently driven is by local outbreaks in different places. So in August it was in Aarhus and the other municipalities here. Now it's in Odense and in the Copenhagen area. The core question that is going to determine the next months and how we fight off the pandemic for the next months is, how do people react to these local outbreaks and the local restrictions that are set in place against them? And here we can use the Aarhus outbreak as a model, the outbreak that was in August, because here we can see how did people in fact react. So one of the things that was implemented in Aarhus before the rest of the country was that it was required to use face masks in public transportation. And what you can see here is from mid-July until a couple of days ago, the proportion of Danes who said that they used a face mask within the last week. The blue line is for the rest of the country, and the red line is for those municipalities involved in the Aarhus outbreak. So there are a number of vertical lines here. So the first red one is where the Aarhus outbreak sort of was announced, and when it was announced that now it would become mandatory to use face masks, and the other red line is when the mandatory policy actually started. Then later, there was a mandatory policy of face mask use announced nationwide here, and then it was implemented here. What you can see is that Aarhus citizens very rapidly reacted to not just the actual implementation of the mandatory policy, but to the announcement of the mandatory policy. And in the same way, you can see that the rest of Denmark also reacted rapidly to the announcement of the mandatory policy, and then further when it was in fact introduced. But this suggests that we have people who are willing to take new restrictions to heart and follow through with them. We can also look at how people's attention to distance change as a function of the local intervention in Aarhus, which was here on the 7th of August. So this is again measured from the beginning of the middle of May until a few days ago. Again, the red one is the municipalities involved in the Aarhus outbreak, and the blue one is the rest of the country. What you can see is that the attention to distance does decrease over the period, as we have also seen before. So as the infections go down, people relax. But what happens is that when the infections begin to rise here in the end of July, the attention begins to move up, both in the entire country and in the specific areas where there is an outbreak. And this is further increased when the local lockdowns in Aarhus was announced, such that citizens in the affected municipalities increased their attention to distance even more. So what this suggests is that people respond flexible. They relax when things look good, but then they are ready to actually to react and tighten their attention to the health measures when things look bad. And there are kind of a spillover effect. We see the strongest effect among the citizens in the affected areas, but all the citizens of Denmark actually changed their attention to some extent. So it's not just in Copenhagen that people are now intensifying their attention to the habits. Most likely it happens across the country. So there are basically three messages that I would like to deliver here today. The first one is trust the citizens. They are part of the solution, not part of the problem. They're motivated to follow health advice, and they do basically as they are being asked to do. The other is that Danes and other citizens listen. So you should make it easy for them to do the right thing. This means that you should facilitate concrete best practice knowledge about how to behave in the current situation. And as a policymaker, you should think in terms of the everyday structure. How can employers, shops, institutions, so forth, make it easy to do the right thing? And finally, what we have seen is that Danes respond adaptively. And I think that's a major important insight. Because they relax in good times, but we should not see this relaxation as a reflection of fatigue, that people cannot hold up the restrictions anymore. It's rather that they relax when they can, and then they are ready to respond rapidly when times turn bad once again. And with that, I want to thank you for your attention.
Thank you, Michael. Any questions? Yeah, Jan?
Yes, just wondering, what do you do as a government to make people realize that they should up themselves when the figures go up? I mean, what should the government do then?
So, I think the key thing is to to signal as clearly as possible that the situation has changed, and one clear way to do that is through press briefings. So it is like the communication to say, well, the situation was this before. Now the situation has changed. And then I think it's important to remind people what are the exact behavioral changes that they should implement in their lives. One of the things that I've been a little bit concerned with in some of the communications that I've seen here in Denmark is that there is general reminders about good habits, that you need to bring back attention to the good habits. But the point is that these kinds of sort of broad statements, they don't really motivate concrete behavioral changes. So people need to know exactly how should they behave. So concrete advice and then this sort of clear signal that situations has changed through press briefings and of course through the exact communication at the press briefings.
And if I may just follow up, how about the communication to different age groups?
Yeah.
Is that different? Because I can imagine that the attention now must be on younger generation,
Yes.
I mean, younger people. Is it the same kind of message you want to herald there?
It's a very good question. So we just released some analysis yesterday where we zoom in on younger generations and how they behave. So what we can see is that unsurprisingly, young people have more contacts with other people. They are, especially their friends, they are less oriented towards avoid gatherings. So they are more social, which is in the nature of young people. They are in a life phase where they need to establish themselves socially, they need to find a partner and so on. So young people behave as young people have always done. What I thought was particularly interesting was that young people actually had the same perception of the health advice as the older generations. So we looked at whether they thought the health advice was more restrictive. They didn't. We also looked at whether they felt less able to follow the health advice. They didn't. And we asked about whether they felt that the health advice was effective, and they thought it was. So the younger generations are not behaving differently because they have a different perception of the health advice. They behave differently, most likely because they are much more motivated to be social. And therefore we can also see that they are slightly more they have slightly higher tendencies to react on the basis of their perception of the health advice. So, for example, a young person who thinks that the health advice is overly restrictive is more likely to not care about it than an older person who thinks that the health advice is overly restrictive. So the question is then what to do about that, so to speak. I think part of the issue is that it's very, very difficult to do something about without doing something very drastically about it. Because again, it is in the nature of young people to be social. So while when an older person like me is acting normally, then I don't engage with a lot of people. But when a young person acts normally, they do engage with a lot of people. So I think what is probably crucial is to say, well, how can you in fact engage with other people while at the same time act in a protective way? Because we're not seeing that they don't care about the virus, that they don't care about the consequences of the virus for society. So it's more giving them tools to be young people and do what young people do, while at the same time doing it in a slightly more responsible way than they would under normal circumstances.
But were the press conferences that Mette Frederiksen gave here in Denmark to youngsters, was it of any help to reach that age group?
That is a very good question. I don't have concrete data that speaks to that exact question, I might have data, but I haven't done the analysis that can answer that question. But I think it's certainly true that young people are to a lesser extent following the traditional news media and are not watching every press conference there is. Potentially there were, I would guess that there also were during the lockdown, but maybe not at this stage. So therefore it is probably important to find ways to get in contact with them. And you can say that the good thing about young people is that many of them are at educational institutions, which means that they are in fact very easy to reach with information. They are right there. And of course there are social media that you can use as well.
Because at schools I could see that small kids would wash their hands without any problems.
Yeah.
But is that because they've been told by elder people to do so, or because they realized that it was needed? I mean, there's a difference there.
Yeah. So, and I think it's a good question. So the data that we have is people who are aged 18 and up. But again, I think it goes back to the question of structure. I think that schools are vital in terms of how young people actually behave. Because again, young people's attention span, especially kids' attention span, is much shorter. They think more about playing with their friends than they think about coronavirus, and that's a good thing. So therefore, schools need to find the appropriate level of structure where you can still avoid spreading the risk of infections, while at the same time also taking care of the well-being of children, because there are, of course, mental health costs as well to a constant focus on the anxieties associated with a pandemic. So it's a balancing act.
Yes, please.
Trusting the citizens is vital, you say. Can you say differences between the countries?
So I think so. In a way, Sweden was another country that followed the path of trusting the citizens. I think, at least also from the new information that has come out about the United States strategy, that seemed to be less oriented towards trusting the citizens. I should also say that trusting the citizens comes with some costs. Not necessarily in terms of fighting off the pandemic, but in terms of the citizens themselves. One of the things that we have been looking into is differences between Danes and Swedes. And while Denmark was under complete lockdown, or more or less complete lockdown in April and March, Sweden was significantly more open and you could say more trusting of citizens. And one could imagine that freedom brings joy and happiness, but according to our data, people in Sweden was less happy than people in Denmark. They felt more alone about how to behave. They were less supportive of the government policies. They felt more stressed. And it's because that with freedom comes a responsibility. Citizens need to make a lot of decisions themselves in a more open society than in a more closed society, and that might not always be simple decisions that they need to make. And I think we are also now experiencing it to a greater extent here in Denmark. With a reopened society, we need to figure out, should I hold that party, should I not? Should I, as a person from Jutland, go to Copenhagen or not? Like there's a large amount of decisions that need to be made now that responsibility is sort of placed on our own shoulders.
But recent figures and recent statements say that the outbreaks that are seen now happen in private circles rather than in reopening of schools, reopening of businesses, public transportation. This happens in private circles. So, is there somehow a thought that people say, well, when we gather at home, nothing's going to happen, and then it happens? Is that the place where the attention now should be?
It seems that that is the case exactly as you are saying, that it is in private circles, parties, for example, here in Copenhagen, funerals in Aarhus was another place, and I guess it is about coming back to this idea of structure, that it's more easy for an employer or a school to create the needed structure. But when you are in your home with your friends, that is the opposite of sort of structured interaction. Like the whole idea with that is that it shouldn't be structured. There shouldn't be one person saying, well, now you go there and you go there. And maybe that is what we need to begin to think about, that what we normally think of as private interactions need to be more structured if we are to keep up an open society.
Sorry, but what does that mean exactly? What does it mean to have a structured private life, for example?
Yeah, so it means that you need to be attentive to distance in when you are having a gathering in your house. That you say, well, you shouldn't just sort of move around freely if you have holding a party with 30 people. That this is your seat, this is where you should be. I guess it's those kinds of things that we need to begin to think about, and at least I think that is what the health authorities need to begin to communicate, because I think that is what they think, that people should behave in these kinds of ways. But I don't think it has been very clearly pointed out that we actually need to think in different ways about how we go about in our private lives. And the potential alternative is the more draconian measures that we see, for example, in the UK, where you can now meet with 6 people, which is another way to create structure. But it would be great if we can find some kind of middle way.
So the word structure here is equals discipline. I mean, you have to have some kind of discipline in private circles to avoid a new outbreak.
Yes, that's one way to say it. Yeah.
Yes.
Michael, just finally one question perhaps here. You're gathering lots of data, of course, as you've explained. Is there any way that you can kind of predict developments in outbreaks, for instance, based on your data, or how do you see that?
So the one of the ideas of these data gathering exercises is exactly to find out, is it in fact possible to predict the development of the pandemic by this sort of huge data exercise. So one of the sort of problem is that there has been too few infections to really train a model until now. But now we see things begin to rise again, and we have some indications that the models that we were looking at could predict the Aarhus outbreak, and now we're trying to validate it by seeing if we can predict the Copenhagen outbreak. But that's that is sort of the goal. That's the major research question. To what extent can we, in fact, use this monitoring of public behavior as an early warning system for doing a pandemic or an epidemic? Because the problem in an epidemic is exactly as I said, its speed. And if you wait with changing the course until you have an increase in hospitalizations, then it's too late. So the longer we can push back the sort of emergence of warning signs, the better.
Thank you. Thanks a lot again, Michael, for doing this presentation. I think that's it. Thanks a lot.
Thank you.